Now let's go back to the patient and see what else we can do here on this setup screen. We already saw the utility, but there's some more things in there that I'd like to show you. We can set the screen brightness, which is very important in setting up the machine. You hit the brightness, keep hitting it, and we'll go through the different brightness settings. You have your diagnostics, which is for your service engineer, so it's not something you're going to be doing. Package, we've already seen package. That's going to set the overall package for your system. And now we have our settings. You can enter your facility name, system, language, the date format, the system time, the time format. You can set all of these. Your settings, how do you want it stored? Do you want the SD card, USB, external hard drive? How long do you want to set the video length for your Cine? Now remember, if you're going to save Cine loops, you don't want to use too much. If you use 30 seconds, it's going to take up a lot of memory on your SD card. So you want the shortest time that you would normally be doing it. If you're not going to be saving long Cine clips, set it to a lower setting. Number of patients on screen when you go to the archive utility. You want a second patient ID. Do you want to enable the printer for the print storage? And what image storage would you like to save? If I chose just the image area, or do I want the full screen with all of the patient information on it? The default is set to the image area. We click on image, and this shows what do you want up here. Would you like to reverse the image so it flips so that GE logo's on the other side? And what type of indexes would you like to show up on the thermal side? System, this is your system information that would be used mostly in a service situation where they would call you and tell you to go through this. And about tells you about your software version of this machine and its install date. We'll go ahead and click exit, and we're ready to go on to the next session.